Share my food at my fiesta. Come inside and eat. Hurry up.
You better leave just one piece of chicken on that plate.
Yeah.
Wear your mask.
That's what we got to do. I keep telling Dr. Ho we got to change up the messaging. It's too nice. It'll be like, wear your mask, stupid. God. 7:10. Let's go back into the KUAM News Zoom room where we have from the Physicians Advisory Group, Dr. Felix Cabrera. Morning, Doc.
Good morning.
How you doing?
I'm doing good.
That's good.
Doc, I feel like last time we talked to you, nothing's really gotten better. I think it's gotten worse with the numbers, the spread of the virus, the deaths, the hospitalizations.
Wow.
Yeah.
So I guess we'll just start there.
It's been tough, that's for sure.
Yeah. So, did you guys meet last night, the Physicians Advisory Group?
Yeah, we did.
So, what'd you guys talk about?
Stuff, weather.
Got jokes.
Oh, yeah.
No, okay, yeah.
Well, obviously, we talked about the different, measures. Basically, one, making sure we had a really good understanding of the lay of the land in terms of where we are currently in this fight, from all different angles. And then, kind of rehashing what's been successful amongst other areas, other jurisdictions, and then ultimately kind of throwing on the table a variety of different mitigation efforts that may or may not be effective for Guam, but at least for further discussion. And again, we do this all in an advisory capacity, and that not an operational capacity, so to speak. And so in the end, it's the governor takes our listens to our advice, and she mixes that with the advice from other from other counsel that she gets, and then she makes her decisions based on that. We try and advise also public health as well, but they have their own views on different priorities as well, and with their their overall resources, and so they have to make tough decisions as well.
Right, Doc. That being said, where everyone's kind of wondering, because we haven't heard, are there going to be any easing of restrictions that are currently in place this week? Is the PAG recommending to the governor to allow for the opening of bars or to allow for dine-in or?
Right, because this Friday is actually the public health emergency. It expires. Are you hearing that it's going to be extended?
Well, if we're going to do anything that's evidence-based and data-driven, then there's nothing in the data right now that tells us that we should be letting up on any of the current restrictions.
Right.
That's I think that's an obvious statement, I think, for everyone, but I understand why you're asking the question, just to in all fairness. But
right.
When we see nearly every day is a record day in terms of hospitalization or number of tests, positivity, and those things are, we can't become numb to them.
Yeah.
And we do constantly look at the current restrictions that as they are, and whether or not they can be lifted safely based on what we believe evidence has showed us thus far.
Yeah.
Again, we have a lot of data, but the data is still in the grand scheme of things compressed, especially within this past just couple of months where we had to deal with the vast majority of this pandemic, as opposed to the prior months before that, which was kindergarten compared to what we're doing now.
Yeah.
This is
Yeah, Doc.
What I was gonna say is, that being said, one of the things we did do yesterday, and we were fortunate enough to set up a Zoom call yesterday morning with members of the both medical and public health community response in Navajo Nation, and basically it was a Zoom call with them, with the surgeon cell and a few other persons from public health, as well as the office of the governor, and just really it was a lessons learned call, and trying to understand from them, what they felt worked for them, and what didn't work, And they had the worst number of cases in the whole country at one point back in April and May, and they managed to bring it down to an extremely low level. But unfortunately, they're starting to see a rise back up as this not as bad as we are right now, but pretty similar to the way the rest of the country is seeing a rise back up, and trying to get a understanding of their take on why that's happening and what they think they're going to have to do next. And so it was a very informative call, and it really it normalized a lot of what we're doing and what we feel we're doing, that we're not alone, and in a lot of ways we mirror with their struggles, and it was there's misery loves company, and so it was one of the things where we commiserated on some of the challenges we had, but it was interesting how they mentioned the things that worked for them also worked for us, and what didn't work for them didn't work for us.
I want to research that. So in Navajo, the Navajo Nation, what can you do? Can you go to the mall 25% capacity, or?
So what they have there again? So Navajo Nation is it spans 27,000 square miles. Compare that with Guam's 212 square miles, but they have the same population as Guam. And they have some advantages, that if somebody gets really sick and is intubated ICU level, they ship them out. They ship them out to Flagstaff, Arizona, or Phoenix, or to even Albuquerque, New Mexico. And so they have a easy ability to get these patients to higher levels of care. But other than that, they still deal with the struggles in terms of those who don't even make it to the hospital. But overall, the number of fatalities that they've suffered is over 570. Imagine if over 570, if our death toll here on Guam right now was over 570. So right now we're at 75, which is horrible by itself. But can you just imagine it much higher than that? But transitioning to again focusing on Guam, this morning GMH is reporting 83 COVID-19 patients admitted to GMH, and then add that with the one ICU patient that's at GRMC who's too sick to transfer. GMH can actually technically take that patient, but that patient is just too sick to transfer.
Wow.
And so. As in, like, they're right now they're better off just being cared for at GRMC is really what that means. And then at Naval Hospital there is I believe one patient there that's a non-ICU patient right now. So the good thing is that we've seen a decompression in terms of COVID patients in GRMC and Naval Hospital, and GMH scaling up a bit in order to take these patients on. But right now, 85 total COVID-19 patients hospitalized on Guam. It's another record day.
Yeah, sadly, I mean, yesterday was just a record day, and now we're breaking that record today. So let me ask you, because I asked you earlier, if you anticipate any easing of these already easy restrictions in place. What about the reverse? Do you, or would you guys, or are you advising the governor to tighten things up a little? Let's say, hey, no more gathering 5 or more, because obviously people think that when you can gather 5, it's okay to gather 500. So is there any, because it's not working, obviously, Doc. I mean, only an idiot would look at this and say, like, I'll keep everything the way it is. And I just feel like we're expecting some kind of change, and this set of circumstances that we're living under it's just making things worse.
Yeah. And so, I think right now the governor is considering a number of different steps to take effect probably with the next executive order this week. And we have identified these social gatherings as one of the biggest drivers, I think, of the continued spread. And what that means is that it says no gatherings of more than 5.
Right.
But really, what does that mean? That just means that you're allowed to gather, and you're allowed to gather in amongst persons that are not of your household. And so, one of the thoughts that we have is that, if you were to take, again, go back to where, there is no social gathering allowed. And basically, what if there's a measure that says that, you cannot interact with anybody outside of your household, that where you would have to take off your mask and not be able to social distance. And so what that means really is if such a an order was in place, then what that would actually mean is that you can't you can't eat with anybody else. Really, doesn't matter where you are, a restaurant, at your house, at their house, at work. If they're not of your household, you can't eat with them, because that means you're taking off your mask. If something like that, something even as simple as that was put in place, and the thing is that we shouldn't need an order to do that and to understand that. So I'm making a plea out to everyone on Guam and anywhere else. Please don't eat with somebody who's not in your same household, your primary residence, I should say. Some people live in multiple households. But by doing that, that will cut retransmission rates by a tremendous amount, because let's get one thing right here. There are so many people in Guam doing the right thing, and they're doing it so well. And when we see continued rise in this is what really contributes to their fatigue, is for those few that are not compliant. And they may not be compliant, not because they're doing it out of malice, or they're trying to do it on purpose. It's that they let their guard down, and they do so great for 90 to 95% of the day. But when they eat, when they relax, they take off their mask, they start talking to who they're eating with, and then that's just a perfect recipe for for transmission.
Right.
And
Doctor, you say
again,
this,
yeah.
you say all of this, but yet for Halloween, for example, we're hearing about all these drive-through, get your candy. We're hearing about an outdoor drive-through concert. I don't know. That just seems dangerous, and exposure is just seems like it's going to be ridiculous.
Yeah.
I just don't see how we can continue to push this message, but yet we're still seeing these things happening.
Yeah. And
and the fact that there's no enforcement, really. There's no teeth to the enforcement.
Yeah. And I know that there's been that's very much outside my lane to comment on, except for saying that it definitely is something that is an important tool. We know that what makes us different than Hawaii, again, Hawaii saw the same rise in the first part of this recent wave that we had in August. They rose up together with us, but they quickly took a turn for a plateau, and we continued to shoot up, and then they've come down. And that was about mid-September. And what Hawaii was able to do differently than we've been able to do here in Guam, in 1 week, Honolulu Police Department issued out 10,000 citations for violations of the executive orders. I mean, they were handing them out like candy, basically. And that's the enforcement that had teeth, and that's probably what was the biggest driver in reducing their overall, rates of new infections. So, we all know that that's an important process. There's multiple ways to get this enforcement part in place. It's not, legislature is one way, but with election in 6 days, I'm not, I don't foresee anything, coming before then. But there is other ways that. As I understand it, that could be done from both the public health side and the governor's side. They have to just do something with the rules and regulations, I believe. Yeah. And I understand that they're working on that, but I won't comment more, because I'm not a lawyer. It's out of my lane.
But let me just ask you
how effective it can be.
For your medical opinion as a medical professional, do you believe that we need to tighten up some of these parameters that are in place right now?
Well, I think I already mentioned, one of the main ones that I think can be extremely, effective, right now. And, we already know that the biggest drivers are, again, these inter-household contacts. And how do we break that up is extremely difficult, because just locking everybody down again is not necessarily gonna do that in a way that's sustainable, because as soon as you lift the lockdown, it's gonna come right back. There's just no doubt that that's going to happen. But how do we ensure something that's more sustainable for us to get this down to a manageable level, and continue this for the next several months until at the very minimum midsummer. Let's set expectations. Now that we're going to continue to be in this fight at this level of commitment for the next several months. when there's World War I, World War II, those lasted years, and so it's a sustained battle that had to take place, and there's fatigue for sure, and we're definitely experiencing it now. But now's a really good time to rally. Now's a really good time for us to take a deep breath and with your mask on and really commit to this and get a better understanding of the vulnerable parts. What are the chinks in our chain that can break break this whole thing. And the other main part here that we have to really understand is what's driving also the hospitalizations, right? What's the good news is that we're not seeing as sharp of a rise in the ICU cases, so that's good. And I want to applaud Guam, because I think what's happening is that they're becoming more serious in terms of presenting to get care earlier on in their illness, as opposed to waiting until they're so sick when they get admitted, they're directly admitted to the ICU, or that they end up expiring even before before they end up dying, even before getting to the hospital. So early intervention is important, and early recognition. And one of the key things that we want to make sure that we communicate with the public is that if you're already having shortness of breath, that's extremely advanced already. And a lot of times there's a term that you may have heard, and if not, you're going to hear it more often, is something called silent hypoxemia, or in other words, silent low oxygen. And what happens is that your oxygen level in your blood starts dropping to a point that's unsafe. Yet COVID does this weird thing where you may not even feel short of breath at the time. And the only good way to identify that is by getting a pulse oximeter. Now it's this little, let's see if I have it on. I left it on my office desk, but it's this little thing you put on your finger. It shines light to your finger, and it measures how the light transmits. And it actually, by doing that, it can tell how much oxygen's in your blood. And it uses capillaries, so that's why it's on the end of your finger. And it's a simple device that costs anywhere from $10 to $20, and it can tell you your oxygen percentage. And typically we want you above 95%. For everybody, if you're below 93%, we start getting very concerned. If you're below 90%, that's extremely concerning, and you really should be in a hospital at that point. And by monitoring that, and again, these are people who have COVID-19, and by monitoring that, especially if you're high risk, if you're above 60 years old, and you have comorbidities, that can identify you early and get you to the ER early, and then hopefully prevent you from getting into the ICU or even dying. And so by doing that, so I'm not as worried about the census rising, because that might actually be a good thing overall. But what I want to see for sure is that our deaths stop, they decrease in the rate of rise. I want to ensure that the ICU doesn't increase in the same rate of rise. And by doing that, we know that we're making a dent. So we got to look at both ends of the spectrum here. One is, what is the community doing to stop the spread, and what are we doing to mitigate the acuity and how sick people are in the hospital. So we got to work both ends.
Doc, one thing that we've seen that's definitely different is in the last few weeks we've seen some deaths out of GRMC. You just said there was a patient that was too sick to transfer, and
yeah.
so.
Naval Hospital.
And Naval Hospital as well, right? So is there any other information that you can tell us about some of the recent deaths we've had at COVID-19 related fatalities at GRMC?
What I want to make one thing clear, and I I think that the JIC does this based on just trying to simplify the information. But what happens a lot is that in these unfortunate cases, a lot of these patients are already they already passed away. They had just recently died in the past few minutes or even hours before the ambulance arrives. But they still perform CPR if they're not a do not resuscitate patient, and they bring them in to the emergency room to attempting resuscitation. And during that process, they get they go through that they continue that in the emergency room, and they get tested for COVID-19. But a lot of times, that most of that is futile, and that they weren't going to survive that anyway. but they end up being labeled as, and in cases of both Naval Hospital and GRMC, it was the closest hospital. And so, so that's why it seems like there's more deaths coming out of GRMC, but GRMC happened to just be the closest emergency room.
Right.
So that's part of what's contributing to that, and that for all intents and purposes, these persons are similar to a dead-on arrival, but they just happen to be CPR in progress. And so, but what we're seeing is a large amount of them are of course older patients, greater than 60. Unfortunately, there was, the young 28-year-old who had passed away on Sunday night, I believe. And so, these are unfortunate, and it just breaks our heart to think about, the decades lost in for a lot of these patients. Even if you're 60 years old, you could still easily have a couple more decades in you. I mean, so that's valuable. That's extremely valuable, and now they're lost.
Doc, can we talk about GMH? Because it is really concerning that there's 83 COVID patients over at the hospital. I mean, what are we looking at? People like just lining the hallways over at GMH? Because I know when we had Lillian on yesterday, she said that they are, been discussing the possibility of moving all the non-COVID patients over to the SIF. Did you guys talk about
it's a difficult decision to make overall, because one, you have to properly staff the SIF, of course, but one of the thoughts is that the non-COVID patients that will move to the SIF are those who who have minimal needs in the hospital. They can't go home. They're not safe for being discharged. But one of the thoughts is that both GMH and GRMC have these number of patients, and there are anywhere from 15 to 30 of these patients that could go to these that could go to the SIF, which is really the SNU, and go back to being what it was designed to be, a skilled nursing facility. And so that might be a better use of hospital beds, because then that frees up the beds in the actual hospitals for the much sicker patients. So it takes a variety of staff. I know this is in constant discussion, but right now the priority in the staffing requests have been ICU level care, or or higher level care nurses. But really for skilled nursing facility, you don't need as many nurses. You do need more certified nurse assistants, for example, some techs to help out, but those ratios change. But right now they're focused on staffing more of the actual hospital beds.
So are you aware if we've made another ask to the feds for another team to be deployed here?
Well, the main ask, the main effort right now is to maximize the contracts that are already in place.
The
and
staffing,
that's with,
the staffing
agencies.
solutions.
And so, yes, and so and New West, and so that's the first and foremost that we have to maximize. We got to squeeze everything we have out of them, and that's what Health and Human Services and FEMA want us to ensure that we're doing, and we are. But we have to prove that that's exhausted before we start trying to look at requesting for DoD assets. And so, or in other words, Department of Defense, healthcare assistance personnel. And so that's that again is really what is a last resort. And we were there at one point already, and where we utilized that last resort. But then now we're at a different place where we have more contract options overall. And so, and the same is happening at GRMC, that looking at bringing in more travel nurses as well. GMH is also offering or has already offered or given some of the travel nurses to GRMC. And the rationale behind that is that to open up more non-COVID beds at GRMC to take the GMH non-COVID patients. And that way GMH can be better suited to use their other new nurses to care for COVID patients. Right. And so, GMH still has like about 40 or so non-COVID adult patients there. And about another 40 or so, peds and basically maternal child health patients that are non-COVID. So there's still a fair amount that are there. And so, we want to still try our best to have the practice of keeping a COVID and non-COVID hospital, but the non-COVID hospital needs to be supported as well in order to do that.
Do we know how many, I guess, nurses do we have over at GMH? Because 83 is like, are we having more COVID patients than we do nurses?
No, I mean, so I'm not one to comment further on the actual nursing numbers, and
Yeah.
because it gets complicated with the with the shifting, and you have to staff them 24/7 and with all the different shifts. But I know there is quite a number of nurses, and they're in different areas that have different ratio requirements, and so so it's I know that they've been pulling nurses that don't typically do floor nursing into doing regular floor nursing, and that's the same thing that can be said at GRMC. You're getting nurses like the nurse educators or ones from the clinics being basically deployed to inpatient to assist in the efforts. And so that's not a ideal situation by any means, but we got to do what we got to do at this point.
Is there any
and,
sort of a trigger or target number of COVID patients that would prompt the Guam Memorial Hospital to say, okay, we need to break out the Blue Med tents? Or it's not going to matter because we don't have the staff?
Yeah, I'm sorry, I missed the first part of that question.
Is there like a certain number threshold that you guys are looking at that would make you guys decide that we need to break out the Blue Med tents?
Yeah, and so the Blue Med tents themselves, we want to set them up, right away, basically, and potentially even at both hospitals, and because no matter what the nursing ratios are or what, when the patients come, we need a place to put them, no matter what. And so if there's the proper space of the hospital becomes not ideal, the Blue Med is extremely good space. I mean, it's negative pressure, so it's as good as any hospital space. And so they're already on island, as I understand, and they're still trying to clear customs, I believe. But I don't know. But what I do understand is that the plan is, as soon as it's ready and cleared, that they'll come up with the plan to set up at least one of them at both hospitals. Is my current understanding.
Okay, so as soon as they clear customs, they need to go up. That's what you're saying.
Yeah, and so I know that there's probably an in-service that they have to be able to put it together. But I've seen the video. You can YouTube the video on it, and you see it can be put up in under 10 minutes.
And just,
which is pretty impressive.
Well, and just I want to just really quickly go back to the discussions that you had with the Navajo Nation. I'm just reading it here that what they currently have is they have a shelter-in-place order, mask mandate, daily curfews, and weekend lockdowns. Are any of these something that, like the weekend lockdowns, for example, are these under consideration by the governor or the physicians advisory group?
We've looked at all different scenarios, and so what we know is that Navajo Nation has a 57-hour lockdown that goes from Friday night until Monday morning. And so there's been different iterations of that has been looked at. One where you give some time, a break for people to go to church, depending on their Sabbath day, it could be Saturday or Sunday. And so those have all been looked at, and the practicality of it and whether or not it's going to be effective. We know that when Navajo Nation started really declining in their cases was when they instituted the 57-hour weekend lockdown, in addition to their nightly curfews. And then when they got down to a good level, they relaxed it to about a 32-hour from Saturday night until Monday morning. And then the cases started to slowly rise. We don't think that it's necessary, at least even the people we spoke to yesterday, they don't think it's necessary because of that it started rising. What a lot of people did was that when for the weekend they just leave the reservation, and then they went to somewhere else, a family that lives outside of the reservation, and so that's how they kind of avoided the lockdown. But that just meant that they're exposing themselves still and then bringing it back in during the week. So because of that, it's not like you can just leave Guam for the weekend so easily, at least not anymore. We're not sure if that's going to be effective at all.
Right.
So what do we need to do other
Well,
than
like I said in the
stay
at the
home?
beginning, yeah, like I said at the beginning of this interview, is one of the most powerful things we can do is something as simple as don't eat with anybody who's not in part of your household. That simple. No matter what the scenario is, whether you're at a restaurant, at work, at a funeral, at a wedding, at a birthday party, don't eat with them if they're not part of your household. Don't eat anywhere near them. And just if everyone just did that, I think we'd see a tremendous drop in cases. It's not going to make it drop completely, we know that, but that would make a significant impact here. And so people, we like to potluck, and our only social contacts tend to be at work. That's outside of our family, but that's where your guard needs to be up the most at 100% of the time.
Right.
Okay, Dr. Downer over here, but it's an important mess, obviously.
Yeah. We need to
Frustrating.
do this.
Yeah. Is that kind of what we see? You're at Adaloop. Is there a big high level meeting here where the discussion we just had is going to kind of be expanded on?
Yeah, more discussions. It's we always have our 8:30 meeting with the governor and her executive team as well, and so we kind of go through the most recent numbers and hash through the discussions of the day.
Yeah.
So we're just here to start preparing for that.
The crazy results last night, Doc. It was 82 positives out of just 591 tests.
Yeah. And so our test positivity rate is still above 12% on a 7-day average.
Yeah.
Our daily new cases per day on a 7-day rolling average is 75-ish, and that's still extremely high.
Yeah.
And so we want to get we need to get the new positives per day way below 20 as a first immediate goal, and we need to get our test positivity rate way below 10%. As our first set of goals. And once we do that, then we know that we're making traction. And so, so again, we try not to be as reactive to just one day's results. That's why the 7-day rolling average is really important. And you're always going to see this on a Monday. It's going to be, on a Sunday evening, the report's going to be, low numbers, and then Monday it's going to be really high numbers.
Yeah.
It's because it accounts for those
3
the rest
days.
of the labs that report from the weekend. So you're always going to see that, but you got to balance that out throughout the week.
So Halloween this weekend, your recommendation, should we be participating in these drive-through trick-or-treating events or drive-in concerts?
Stay home. Just stay home. Trick or treat at home, in some creative way.
Easter egg hunt.
when you have
Doc, what do you think?
when
Easter
you-
egg hunt in the house with hiding the candy. That's a good one to stay home to.
yeah, I did that in Easter with my daughter. Hid the eggs around the house. So we just did it that way. The reality is when you have these drive-through stuff, you tend to pack other people from different households in the same car. So again, it goes back to what we've been trying to preach here. And so because of that, just stay home, stay with your family, make this a nice nuclear family event, and then maybe get more than one costume for the kids and have them have a different part of the day as one character, and then as
Right.
another one, and so we do 9 day, and I believe it's supposed to be a full moon, and so it's going to be interesting.
Yeah. Thank you, Doc, for your words here this morning,
Yeah.
and good luck. And say hi to the Gov for us.
I will.
Thank you. Thank you. Unless it's going to get you in
All right.
trouble. We don't want to get you in trouble. You read the room first,
Yeah.
and you're like, hey. Yeah.
I have to go.
Okay.
All right.
Okay,
everyone.
Doc.
Take
See
care.
you. Right.
All right. Please stay safe.
You
Okay,
too.
Thank you.
There you
Bye.
go. There you go. Stay home, guys.
Yeah,
We're gonna go over the comments. A lot of
Yeah,
comments.
I had actually pinned a couple of comments. I bookmarked them because I thought these were very interesting. We were talking earlier in that interview about, and I think Bree brought it up, about needing a stronger, more aggressive, more direct, and almost like the scared straight approach, right, to getting the message out about why people should stay home. 2 comments in particular. One person says, pleading and asking people already doesn't work. So change the tactic. before more people die. And you know that kind of, and it's by all means, it's not challenging Dr. Ho Nguyen or Dr. Felix Cabrera's sincerity, and it's not criticizing their compassion. It's just saying, you know, the pleading and the asking nicely, that affects a certain amount of people. Other people aren't buying it. And then JB Munya also says, please do not applaud Guam. We, the community, have already proven that we are agagwat AF.
Yeah.
Basically saying, you know, there's a lot of people who are misbehaving, either not paying attention or paying attention, and then deliberately not abiding by it.
And they see it. You know, JB is a firefighter.
Yeah.
They see it every single day
Mm-hmm.
when they respond.
So he sees the condition of the people and the severity of their
imagine
conditions.
what they respond to. You don't know. It could be at a social gathering. So
Yeah.
they see this every single day.
He also comments,
go ahead.
why do we need the government to enforce more restrictions? Why those people in line at DFS? People are choosing to not be safe. Rosemary Laguatnia writes, as I said earlier, mixed messages are coming out from the administration. Marie Regis comments here. This is on our KUM News Facebook Live, by the way, guys. That's Edward R. Murrow Award-winning. Marie Regis, our individual actions don't affect just us in a pandemic. We can do all the right things, but we can be infected by those who don't care. Taylor Cruz, will the legislature consider fines like Hawaii?
That was a big point in the very beginning because they said it was Hawaii, and Nestor Lecanto actually did it in an episode of In Full Zoom, where he got former Guam reporter and now Hawaii Senator Glenn Wakai was saying almost immediately the Hawaii governor said, if we catch anybody outside and you're not out there because of an emergency or official business, $5,000 straight up. And that really did a effective job of keeping people inside because they were like, wow, you know, and they were like, HPD isn't messing around.
Yeah,
well, I believe there was legislation.
Ours came out like several weeks after
that. They flaked on it. You know what I mean? Betty Diaz comments, what good is the Physicians Advisory Group if they don't cancel that concert? We don't need a lawyer. OMG. Margaret Hattori Uchima, she's a frontliner. Too many mixed
She's the dean
messages.
of UOG nursing.
Yeah. Too many mixed messages in our efforts to satisfy the most vocal sectors. How are we supposed to understand when the messaging is confusing? Paloma Ramos writes, the governor, Physicians Advisory Group, and Public Health have always stated we need to stay home, wear a mask, and social distance. We've been under this public health emergency for months. People know what to do. They just won't do it.
I kind of liken this to, like, you know, we all grew up in the 80s, the four of us, right? And remember there were those, at the time, First Lady Nancy Reagan. She came out and she was this very lovely, stately, matriarchal woman, and it says, please, kids, I care about you. I want to see you succeed. I want to see you be a good citizen. Please don't do drugs. It was very, very nice. And then a couple months ago, that message came out that this is drugs. This is your brain on drugs, showing an egg frying. And that really tended to affect people.
It was a
because
pivot, right?
Yeah, there's some people who just, you know, I mean, and, you know, Dr. Cabrera always talks about culture. Tough love works in our culture. And I've always believed that, you know, what, and Chris, you know this because you said, like, if you're messing around with your cousins, right, and your grandpa saw you doing something like, say, like you step on his favorite, you know, calamansi bush, or, you know, like the tree falls over or something like that. What is typically is he going to do? He's going to use an effective Chamorro parenting tactic and shame you in front of your peers. He's going to basically discipline you in front of your cousins, and that in itself will get you to shape up.
You can't shame anybody in 2020, Jay. It's against the rules. Ed Titano comments here, why not locking down temporary until we can bring down the number? We already know that it just takes a handful who don't comply. Why no enforcement on those breaking the governor's orders? Pleading the people doesn't work, right? And then Margaret writes, a concert? Heck no. Please say it's not really going to be allowed. Janice Sablon, before we start talking about fines, more still needs to be done with more education and communication about how to deal with daily life with a variety of scenarios, homework, socially dining, teaching how to live and function amidst the pandemic.
Here's an idea, guys.
David Santos had a good comment. Why is it not okay to drive up Halloween, but it's okay to grab and learn that very day?
Right.
Good point.
Well, here's an idea. We haven't talked about this, but we had the Archbishop on yesterday. So the governor's making these statements. People, for the most part, are not abiding by it, right? The doctors come out and they honestly plead people are not following those. Do you think if the Archbishop came out and said, for your sanity, for the health of our community, for your salvation, stay home, do not go out. I, as the leader of the flock on Guam, which is what, 88% of the island, if the Archbishop came out with a strong message and says, do not go out, you know, except for mass or some other things, do you think that would have an effect?
So.
You don't think so? What do you think, Chris? You think that would hold any weight? I mean,
People are going to do what they're going to do.
Yeah, but I mean, it also doesn't help that we have kind of a leadership vacuum. We don't really hear from the governor. It's shameful. It really is, and everybody says it. I mean, if they don't, agree with the governor, she's still got to come out here and be on the front of this, as a leader. Margaret writes, the messaging is confusing. When money is the priority, not community well-being. Many examples given by the viewers, brave viewers, for calling out bad situations.
Or maybe it's as simple as this, because Maggie Anderson says, I feel the message has been consistent. I agree, people know what they should do, they're just not doing it. So for those people, they just need different motivation.
Right. Maybe the carrot isn't working, they need the stick.
Yeah.
At 7:49, we got to take a break real quick. We're coming back with Maria Pangolin.